Looks like we are started. Welcome, everyone. I'm Karen. I'm from America Outdoors. I'm here with Maureen and Teresa from Cornerstone Safety Group, and we are getting ready to start the webinar. But before that begins, I just want to thank you for coming. I want to thank you for those of you who are members of our association and support us regularly with donations and membership. We truly appreciate you. We are grateful for you and your support. Those are the things that allow us to have the resources to put webinars and things like this on. I also want to just mention the fact that we're grateful to have you because we know this is so important. Um, Today, especially, it's very timely, we're 2 weeks out from Hurricane Helene, and we're not even a day out from Hurricane Milton. And we know and we want to recognize that we do have people on the ground on those front lines um, doing search and rescue. And so this is such an important and timely topic for them. Not that it isn't for our industry every day. We are on the front lines and we don't get to just go home from work sometimes, and we're each other's support. So we think that this topic, the safeguarding mental health in the outdoors, is so important. So thank you for being here. The session will be recorded, so we'll have that posted. It should be downloaded and up on YouTube tomorrow. If you have any questions throughout the webinar, please feel free to use the Q&A. You can do that privately or to the group. You can use the group chat, or you can put your hand up to ask questions if there's something that comes up right away. We want to make sure that we get you the attention you need. So with that, thank you all for being here. Maureen and Teresa, thank you so much for being here. I'm going to turn it over to you.
Thanks, Karen. Good morning, good afternoon, everybody. I am really excited, and I know Teresa is really excited to be here. I think both of us have such unique perspectives on outdoor education, and especially being mental health clinicians. And as Karen really just painted such a good picture, I mean, this is just such a timely conversation, right? So many of us have either been directly impacted by Hurricane Helene or Milton, and we're really just trying to kind of safeguard our own mental health during this time. I think just also broadly, this is World Mental Health Day today. And so it is just such a timely discussion to start having this opportunity to talk about mental health. So a little bit about Cornerstone and who we are, and potentially why we work in this industry. So I have a little bit of a unique background. I'm a psychiatric nurse practitioner by training. I also have a background in clinical psychology, and I'm the mental health director at Cornerstone Safety Group. And as Teresa and I were kind of talking about putting this presentation together, we were just really remarking on the fact that we have very different backgrounds. So when I started working in the US, I was working in rural and remote healthcare, and also worked as a clinical and a program director, but always alongside guides and staff. I myself have never been a guide, but I've often found myself in outdoor recreation activities and having to respond to psychiatric emergencies by myself, which is really kind of jarring, and it just really gives me an appreciation for that vulnerability. And so the work that I do currently is I work in an international context, and so work in really remote and austere environments. I always love to say that I love to be able to provide mental health services to people in hard to reach places. And so, Teresa, I just want to pass this over to you to introduce yourself as well.
Hi, yeah, I'm Teresa Jennings. I'm a licensed clinical social worker out of Durango, Colorado. I started off, teaching rock climbing and backpacking at the University of Colorado, then transitioned to being a river guide for many years, which consumed my whole life. Then I worked in some expedition style programs for young people, so backpacking, rafting, service trips, worked abroad, taught abroad. And now I work in mental health and public education. So I work with students with social emotional disabilities, and I run the substance abuse programming for my school district. So kind of all over, but my heart and my journey started guiding in the wilderness as a young adult.
And that's really where I think Teresa and I tend to complement each other. The beautiful thing about providing mental health services in this industry is that we often have very unique perspectives and backgrounds, and yet somehow we come together to find common ground, and it creates opportunities for innovation and to be creative. And so at Cornerstone, I think one thing that's really important is that we actually approach things from a risk management perspective. We're a risk management company, but during the pandemic, there was this great pause. And so our CEO, Dave Dennis, recognized that this was such a prime opportunity to bring together services and really integrate opportunities so that when you're working on a program, you have access to risk management, you have access to mental health and medical services at your fingertips, and really just to help to provide some peace of mind when you're especially out and about. And so that also introduces our last team member, which is Margaret Kelso. So she's a risk management advisor, but has worked in a therapeutic setting and often provides a really unique skill set and just perspective on how we can manage things from a programmatic standpoint as well. And so we really provide mental health services throughout your program's life cycle. So this can be everything from identifying people that have maybe mental health conditions or unique conditions that maybe need some accommodation, right? So we are seeing an uptick in mental health, particularly with students or with participants. And so we really want to be able to accommodate and also train and equip our staff so that they don't feel like they're in a vulnerable position having to provide services where they just don't feel equipped to be able to do so. And so that's really where coaching and also crisis assistance comes in. So when you are working through an issue, whether it's supporting a staff member or whether it's supporting a participant, we are always available to you to be able to provide just some additional support or additional perspective as well. And really what we want to be is just an added resource to you and your staff as you navigate the demands of this season. So I love talking about neurobiology, but I'm not necessarily going to go into the neurobiological benefits of being in an outdoor setting. However, we do know that these are really deeply rooted in experience. I think one thing that is so powerful, especially from a therapeutic standpoint, is the experiential learning and the transformative experiences that people have when they're in an outdoor setting. And so this really oftentimes we're focusing on participants. We want them to have a good time. We want to get good feedback so that people come back year after year. It keeps our doors open, but we also have to focus on our staff too. And so we have to understand and appreciate that people are going to be responding to new and at times stressful experiences, but it is often in a contained environment. It's in what we hope is a supportive environment. And that in our minds really starts at the top, right? It starts within the organization so that staff feel well supported, and that trickles down to participants as well. What's really important about this is that supportive environments need positive human connection, right? So this allows us a safe container to be able to examine ways that we are showing up in our lives. So even if the program is just for a day, right, it's just a day experience, it does allow us to have some opportunities for micro adjustments for how we approach things. That provides opportunities to learn how to approach things differently. It also allows us to kind of experiment in group dynamics, right? We're coming into a new group, a new season, and there may be people that we might struggle with, or there may be people that we really connect with. And it just helps us to continue to expand our capabilities to connect with other people. And so when we engage with staff and participants, that really allows us to grow and challenge each other. And what we're doing is we're coping and adapting. So when we're coping and adapting, I think what's really unique about this industry is that we're often leaving the ordinary behind. So many times we're making a conscious decision to not necessarily follow the typical in-office 9 to 5. So even as a mental health professional, I kind of laugh that I'm in this industry because I used to have pictures of nature all over my office, right? And the reason that we do that is because of the therapeutic aspects that nature brings us, right? We use it as a tool sometimes to actually help patients ground themselves and relax. And so we are making this conscious decision to leave the ordinary behind, right? To make a different choice of how we want to live our professional lives. And there's often this excitement, right, about this call to adventure, doing something different. We're breaking from the status quo, and that can be really energizing. But what's really important is that we're often meeting mentors, right? So from that first interview, that's an opportunity for mentorship. That's an opportunity for us to be able to set the tone for how we want to support our staff, right? So I think when Teresa and I were talking about putting this together, about safeguarding mental health, we often talk about the participants, and we were kind of making this like offhanded comment that we often talk about staff wellness at the end. And so it's really important, and we really want to highlight the importance of working with staff and the importance of their wellness. So meeting that mentor, you're bringing in the experiences that you have from the outdoor industry to help people already set up their own emotional wellness. Because what they're doing is they are crossing a threshold. Even though they are leaving the ordinary, even though there's this excitement, they're crossing this threshold. And what we're seeing in our industry is that some staff are actually having difficulty just crossing that threshold. So you may onboard them, you may take the time to train them, and then it's day one and they're not there. They decide they don't want to do this, they back out, and that in and of itself can be really frustrating. So sometimes we have to be really intentional about how we're connecting with staff from the moment that we meet them and the moment that we offer them that job, because we know that there are going to be trials and challenges. As much as working in the outdoor industry is energizing, it's exciting, it often leads to these wonderful experiences of connection, right? It gives us a different perspective. We know that not every day goes perfect. I think over the summer, what Teresa and I realized is that our mental health team was really busy. And I think what we also realized is that many staff on the ground weren't just dealing with one issue. There were multiple trials. There were multiple challenges. It wasn't always just working with a student that had a mental health issue. It was also working with how do we help support the group as we're also supporting a student? What do we do about the policy if there's challenges with maybe headquarters and staff? What do we do if we have different perspectives? And so these are all these challenges that we're experiencing while we're in the program. And I think throughout that process, what we're doing is we're looking for allies, right? So do we have allies in our co-leads? Do we have allies within the group? If I give an instruction or a direction, is the rest of the group going to follow it? Are there other people that I can look to that are going to help to support me? And that also comes from just within the program, right? And within HQ. So who are the allies? Who are the friends? Who are the foes, right? So because there are going to be these challenges, and sometimes they're going to be interpersonal, right? Especially when we're dealing with supporting participants, or in some cases, when we're working with children and adolescents, we're also working with families. So that can kind of complicate the picture at times. We have to figure out who our allies are. And all of this leads to transformation, right? It can be positive transformation. It may not be, right? But what we're doing is we're really trying to foster experiences for our staff so that they feel like they have an interconnection with themselves. They feel connected with nature. They feel connected socially and with the group. Because what happens is people are able to take those experiences home, right? So all of this is about making adjustments as we're going. When we talk about like stress continuum, we're often talking about like these dynamic equilibriums where we're constantly making these micro adjustments. But when we're able to support staff and do that successfully, what happens is we're allowing them opportunities to reap the rewards and bring those home with them. Because whether they've had an amazing summer and they'd come back year after year, or whether they've really struggled, they are going to integrate that into future mentorship. I think the beautiful thing about this industry is that we see people have experiences from guides and then being in leadership positions and many times owning their own companies, right? So they are taking those experiences and continuing to perpetuate them, right? And that's what helps to strengthen our industry. So this is a hypothetical situation, right? But I want you to think about this because I think all of us at some point have been through this situation. I know I personally have, especially being on call over the summer. It was a very busy summer for the mental health team, as I said, but Adam has always loved guiding others through the wilderness, sharing the beauty and the thrill of the outdoors. However, this year feels different. The constant demands of scheduling, managing groups, and ensuring everyone's safety weigh heavily on them. They've taken on extra trips to meet the high demand, leaving little time for rest or self-care, right? And especially as we're coming out of the pandemic, we're seeing that, right? There's often higher demands that we're trying to meet. And so one evening after a long day leading to a challenging hike, Adam returns home exhausted. Their phone buzzes constantly with messages from clients, coworkers, and family, all expecting quick responses, right? So especially in leadership positions, many of us have been in this situation. But I do want to ask the group, and feel free to just write in the chat, or if you can take yourself off mute, that's okay too. But as you're reading this, one, does it resonate with you? And two, does this actually meet criteria for mental health? And what's your perception of mental health?
I feel like those are big questions, Maureen. It might take a while for
And
them
I
to come
just saw
through in the
that
chat.
Ruthie said that the chat is disabled. Thank you, Ruthie. Okay.
No.
All right. Well, okay. So,
Wait. Oh. Yep.
all right. Well, as we're working through that, I think what can be helpful to think about is that when we're talking about mental health, we're often talking about it on a spectrum. So many times we're often thinking about mental health as an individual that has been diagnosed with a mental health condition. And while that does fall under the umbrella of mental health, really, when we're working with people, especially at Cornerstone, that are experiencing challenges with mental health or need support with their mental health, we're talking about it through a spectrum. So first part of the spectrum is wellness, right? So we want people to maintain their wellness. That's the goal. So when we talk about supporting staff's emotional and mental well-being, we want to be able to provide support when they're feeling well, right? So this can be self-directed activities. This can be having opportunities to take breaks, right? So many people, especially in the service industry, they really want to be supportive. They want to be of service. Oftentimes they're taking on more than they maybe have the capacity to in that moment because they're really connected with the mission and they're really passionate about what they're doing. But we also sometimes have to coach people so that they recognize that wellness is something that is to be maintained. Right. I think the other thing that's really important to recognize that these are challenging environments that we work in. They're often really condensed periods of time. They're often seasonal. They're often cyclical, which means that many times we're going 0 to 60. So there are vulnerabilities that people can share, right? Especially coming into new group dynamics. So when we think about at-risk populations, we have to also recognize that that is part of the mental health spectrum. So when I say at-risk population, it doesn't necessarily mean people who automatically are within this category are going to develop a mental health condition. It just means that there may be stressors or lack of resources or some marginalization that causes them to maybe be more susceptible, right? And we have to think about that from a staff perspective. So an example of this would be working with children and adolescents, right? We know that the majority of onset of mental health conditions occur in childhood, so we have to really be mindful of that, right? And that sometimes can be stressful for staff to have to support multiple students that are experiencing mental health conditions. Other times it can be marginalized populations, so individuals who identify within the LGBTQ plus community, individuals who identify as people of color, women, people that have experienced interpersonal violence, right? People that may be more susceptible to alcohol and substance use. So these are some issues that you also may have to provide support around, right? Whether it's connecting with your staff or knowing of resources within our communities to help them to get that support. Okay. Last but certainly not least are the individuals that meet criteria for a mental health diagnosis, right? So again, if the majority of mental health conditions are starting in childhood and adolescence, there stands pretty good chance that many adults are also going to be experiencing some mental health symptoms, right? These could be well controlled, they could be in remission. Sometimes they become exacerbated when people are in an outdoor stressful environment. right? Other times people are having a new onset of those conditions. So it is just something to be aware of.
Real quick, I think the chat should be working now. I'm sorry about that.
Okay. All right.
Or
Feel free to ask any questions that you have or comments as well. Teresa, over to you.
yeah, totally. So any discussion on supporting, mental health of participants or our staff starts with talking about supporting our own mental health and emotionally caring for ourselves. I think we've probably all heard this a million times, but if in order to care for our participants, we must be able to care for ourselves. In order for our field staff to care for our participants, we have to be caring for our field staff, right? And so how do we do that? One of the first steps is knowing the warning signs. And so Maureen was just talking about this piece that we work in a field that can be very high stress at times, right? You think about peak season, you think about field staff out there for 24 hours at a time, all the questions, all the scenarios coming at you. Over time, what that does is it builds up your baseline stress levels. And so when your baseline is higher, your reactivity is higher. So the way you know that you're maybe starting to struggle is like things like being quick to irritation, right? So if you're becoming really snappy, if you're just grumbly, like either when it's at home to family or to your coworkers at work, that increased irritability is a sign that you're getting a little burnout. Diminished problem solving skills. This is fascinating, but the more stressed we are, the higher our baseline stress is, the lower our IQ actually is. And a great example of this, I think everyone has had the experience of being in an argument with someone and you walk away and you think, oh my gosh, I wish I had said this, or I wish I had said that. Those are just examples of the way our brain functions when we're under a lot of duress. And when you think about the jobs we're being asked to do, there's a ton of decision making that needs to be made. So being able to take our baseline stress down becomes like imperative in our ability to function in our jobs. Increased reactivity, again, I mean, for some people, you'll notice it, more rapid speech, not being able to listen, being shut down, not being able to focus. These are all signs that you're pretty stressed, right? It can also manifest physically. So headaches, stomach aches, there's lots of different ways your body will tell you that you need to take a break. I think oftentimes when we talk about wellness and mental health, we think of things like, oh, I need to take a vacation, or I need a day off work, or I need to go to therapy. And all those things are great. But I think, as we all know, they're not necessarily always practical in our roles, especially when we're in the field. But the great news is the most effective way to like lower those baseline stress levels is actually by doing little chunks of regulation throughout your day. And this can be minutes or seconds, but by doing this, you're building in supportive time consistently to keep those baseline levels down. It can actually be more effective than taking large chunks of time off. So what can that look like? There's a ton of different strategies here, and it's different for every human. These are just some ideas that are pretty common. So taking a break, even for seconds, right? If you need to walk away from a group just for a few seconds, just for a minute, drink a glass of water, that can help quite a bit with those stress levels. One thing I used to do when I was a guide is I would get those little, Justin's peanut butter packets. And when we would get to camp, I would take my 5 minutes away while students were setting up their tents, and I would just eat my peanut butter packet. It was like my little mindful eating moment, a little ritual I could do twice a day that helped me kind of reset and let go of all those burdens. Co-regulation is huge. This is the piece of this idea of emotional contagion, right? How we are can impact the people around us in both positive and negative ways. But one of the gifts of guiding is you're often not the only field staff out there. And so if you're having a really hard time, being near and connecting with the field staff who might be in a better space is deeply regulating. Having connections, for me, that is one of my most effective ways to stay calm. Like, even if it's just joking around, like if you can take 30 seconds to go joke with a buddy, that will definitely help de-escalate. Eating meals, hydrating, sleeping, kind of that basic self-care stuff is like imperative for sure in keeping ourselves healthy in the field or at headquarters during busy times. Deep breathing. When I was a young guide, when people would tell me to take deep breaths, like that used to drive me crazy. But it physiologically is an effective way to calm your nervous system. The strategy I always teach now is called square breathing. there's a million ways to do this. This is just my favorite. I'm going to share with you guys real quick. Square breathing is when you breathe in for 4 seconds, you hold for 4 seconds, breathe out for 4 seconds, and hold for 4 seconds. And you do it 4 times. And if you do that, like if you have a heart rate monitor on or a watch that tracks your heart rate, you will watch your heart rate drop. It's an incredibly effective strategy. Easy to remember because of the 4. And the counting kind of helps get yourself out of your head and reground you. Great strategy for when you can't walk away. And then this piece of knowing when and who to ask for help. And this is something we're going to talk about kind of throughout the presentation. But the more we build in like predictability in our structures for our field staff, the calmer you can feel. Like you need to know where to go and who to go to. It actually helps us feel more in control and safer if we know what our options are. I think we should test the chat real quick. If you can, type in what is something that helps you regulate or a trick you've used either in the field or in the office before when you're feeling kind of overwhelmed or stressed. Let's see if this works.
It should be working. And
Give it a
people
minute.
should be able to use their microphones too if they need to or want to.
Well, sure. If anyone wants to share a strategy, you can do that. Oh, morning hot coffee. That's such a great ritual. It's one of my absolute favorites in the field. Like that is like the me time completely.
Yeah. Breath holding, morning hot coffee. Awesome.
Love it. Yep, coffee.
Mm-hmm.
Despite it being a stimulant, I like completely agree.
This is a judgment-free space.
Yeah, totally. And while people are writing, I just also wanted to share, something Maureen and I have been supporting organizations with is the idea of talking through this before going out in the field with your guide teams, right? So sometimes it can be hard when we're in it to notice when we're really, really struggling and need support. So if you have this conversation ahead of time with a colleague and you're like, hey, when I'm feeling stressed, this is what it looks like. I get real irritated and I shut down and I will not engage with the group. That helps the co-leader know, okay, they're having a hard time. Either I'm going to tag them in or I'm going to tag them out. I'm going to remind them of some strategies. We're going to have this whole conversation beforehand so we're able to support each other better.
Mm-hmm. Yeah, and I would say just from our own experience, I think that some staff have done some prep like this, but oftentimes I think the gap is we're often focusing on the individual, right? We're helping the individual with stress reduction, but we're not necessarily looking at how we're going to be able to perform in a team. And so most of the time we tend to be a little conflict avoidant, right? Like we never want to think about the time that we're going to really disagree on something and really get angry with each other or really get upset with each other. And so sometimes being able to do that proactively, you're already helping the co-regulation process. So just you being able to respond to somebody and recognizing that maybe they're not trying to be a difficult staff member, maybe what they're showing you is just some of the signs where they're starting to get to that point where they are not able to manage their stress or their emotions the way they would if they weren't necessarily feeling that level of intensity of the situation. And so I think the other important thing is that oftentimes we can get into a narrative about other people's behavior, and just using some of these strategies helps us on how we are going to approach the strategy. Oftentimes, I think from a therapeutic standpoint, we ask, what is the goal that you want from resolving this conflict or resolving this situation? And most of the time, the goal, especially if you're on program, is you also have to maintain the relationship, right? So you can't necessarily just say whatever comes to your mind and really hurt the relationship so that it's beyond repair.
Yeah, and I'll add one more thing to that, Maureen. And we both kind of mentioned this, but I always go back to that idea of a dysregulated person can't regulate another person, right? And so if we're not able to do this well and bring our baseline down, we will not be able to effectively support participants or guests in the field who might be having a really hard time. It's really like kind of a key central component to being able to manage complex situations.
Right. Absolutely.
So what are some proactive strategies, we can put in place from the top down in our organizations in order to support our programs? And so one thing every single program on this call has in common is that we take people out of their comfort zone, right? So all of our participants are out there trying something new, and so are our field staff. Every single trip's different. The variabilities are incredible. There's a lot of gray areas. So every time a trip or a program leaves, people are having a highly novel experience, which is great, right? This is one of those things. This is why people come to our programs, is to grow and learn and become more resilient, right? But it also adds a little bit of stress. So like that baseline level of stress is always going to be a little higher than it is when we're in our comfort zone. So how do we set the container so that our guests and our clients are able to come into our programs and take the healthy risk, right? And engage fully in what we're offering them, despite that kind of increase in stress. And so one of the things I talk a ton about is predictability. I just think it's so important at every layer of an organization that we're able to provide a felt sense of safety through some predictable structures. So there's the pieces that are obvious, right? Like, how do we ensure people understand what's going to happen? Like just the piece of lining out the day, making sure, if you need help, here's how you get it. If you have questions, here's how you ask it. All that's incredibly important. But one piece that's super important that we don't always talk about is predictability and responses. And I was recently talking to a trip leader who said they were having some hard times in the field, but they really didn't want to call headquarters because they didn't know how they were going to respond. And so there's this piece of, if someone's calling and asking for help, and sometimes we're really regulated, we're taking care of ourselves, we're able to respond in a really empathetic and supportive way, that'll feel good. And people, they'll ask for help more often. But if the next time someone calls, we're really dysregulated and upset, and we kind of shut them down, or we don't listen, or we're dismissive, it creates the sense, that you don't know what you're going to get. It causes a lot of anxiety, and it prevents people from asking for help when they need it, for problem solving when they need it. And it's an undercurrent of stress that your guide team will feel if they can't count on their headquarter team to be predictable. And the piece of that is our participants in the field, they know when staff aren't happy. They know when staff aren't getting along. It is felt in a program. And that is one of those pieces that can make it feel less safe, and it can make it harder for people to fully engage in what we're offering. So this really important piece of being predictable from the top to bottom of our organization, in my opinion, is it's a foundational piece of supporting mental health in the wilderness. Mm-hmm. That ties into this idea of staff and organizational regulation, which is kind of what we just spoke about. But that piece of taking care of ourselves so that we can show up and take care of others is experienced just like anything else, right? So if we want our guides to be able to provide that experience, we need to provide it for them. So really modeling and using the strategies from that last slide to create a culture of regulation is extremely helpful in creating a safe environment in the field. Clear communication. I don't know if there's any Brene Brown fans out there, but she always says clear is kind. And I just love that. I think it's so helpful in these complex scenarios we're working in. We need to be super clear about expectations. We need to be really clear when there's an issue and addressing that issue. And we're going to address it in an empathetic way, ideally, if we're wanting to have a really healthy structure, but it doesn't help anyone to not know what's going on and to not get feedback and to not have those hard conversations. So I always remember clear is kind. And then when we have those problems, empathetic problem solving, it's my favorite tool to use when issues arise, and it's so simple. And basically, if a staff member comes to you, or if a guest comes to a staff member with a problem, the first piece is just to listen, which sounds so easy, right? But it's that idea that you're not going to say, oh no, but what about this? You're not going to put your opinion on them. You're not going to cut them off. You're just going to listen. And I'm telling you, there's not a single person in the world who doesn't feel more heard and who doesn't settle down a bit when they're just listened to, right? So what you're doing in that moment, if you're able to do this, is you're regulating that person, right? Then you can share your side. So you let them speak, then you share your side, and then you can work together to solve the problem. And it might be a scenario where you need to use that really clear communication and draw a boundary, and that's fine. But it'll go infinitely better if we do the listening first and then move on to like maybe that tougher conversation.
The other thing I'll add on that is that empathetic problem solving directly relates to predictability. So when we're able to access empathy, that actually means that this part of our brain is working, right? We are able to make executive decisions. And so when we're able to use those calming strategies to help us regulate our thought process, that helps us to access empathy. It helps us to start asking questions and listening as opposed to making reactive judgments. And when we're able to model that, that has a trickle down effect. It enhances the predictability. People know how you are going to respond in a situation. So there's an increased likelihood that they will come to you to talk with you about it. Right. And I just want to be clear before we move on. Being predictable, even if you're having a strong emotional reaction to something, doesn't mean that you fake it. Right. So if you are not in a place where you can be empathetic, right? Or if you're really struggling with a situation, but you feel a pressure to respond, it is okay to take a few seconds to yourself to help yourself regulate before you jump in, because that will actually help you to get to the place of predictability, as opposed to just saying, I'm fine, I'm not angry about the situation, and I'm here to support you, right? Because people can pick up on that dissonance, just like many of us have been working with students or with participants. And when they ask us what's going on and we say, I'm fine, but we're really not, we know that they can pick up on that.
The key component of this, when things are going wrong, is this idea of getting curious. And I circle back to this with everything. Because sometimes what tends to happen is we'll place an intention on someone that is a conclusion that we're just making in our head, right? So whether it's, this person is just not working hard, or this guest just isn't a good fit for the program, like these kind of things, our brain is trying to make sense of what we're seeing, and so we're putting this intention on the scenario. When it's really, really important, we try to always come back to getting curious and gathering more information before going to those next steps. I have noticed that as a sentence starter all the time. It can be very, very non-judgmental, right? So you're not saying, I've noticed that you don't care about your job. You would say, hey, I've noticed you're coming in late. You use non-judgmental examples, just like factual examples to start the conversation. What's going on with that, right? That opens up the door for someone to share, and they're much more likely to share when they don't feel like they're being judged. I think a huge one when people are struggling in the field is starting with like, hey, has something like this happened before, and what's helped? Just a question like that can open so many doors. Oftentimes someone maybe with anxiety, could say like, hey, well, when I go to therapy, I like deep breathing really helps me, or taking a break and walking away really helps me. Great. Now you have a strategy. Go with that. And then is this something that's been hard for you before? Like really exploring what their past experiences are and what might be able to help them in this scenario. And then you can make your decisions moving forward. But really, like I always have to remind myself to assume positive intent, get curious. Assume positive intent, get curious is like my little mantra when I'm struggling with something.
Mm-hmm. Yeah, and I'll add too that I think many times before people come to us for support, they have often tried multiple different strategies, right? So sometimes I think when we're in a helping profession, we often kind of get into this habit of either using kind of some of the mental health skills that we have, which are kind of these active listening skills, nodding our head, making eye contact, saying yes, but also then sometimes we get in the habit of just telling people, right? Telling people how to fix it. And I think sometimes that really narrows opportunities to be curious. And so people can, especially if there's a professional dynamic, sometimes people can kind of shut down a little bit if we're just telling people what to do. And so being able to stay wide and stay open and allow people to tell us what's worked, what hasn't, has been really helpful. The other thing I'll add is that many times when we do mental health training for staff, the most common things that we hear are, I don't want to do the wrong thing and I don't want to say the wrong thing, right? I think especially when we're supporting people emotionally, we get really conscious of the words that we're using. one tip that we use, especially in a therapeutic setting, we ask questions. Sometimes we ask questions, and I'm probably not supposed to share this, but sometimes we ask questions because we don't know what to say, right? We don't know how to solve the problem for the person. And so we reflect and we ask questions and we're trying to clarify information. The best part of that is that the person on the receiving end then feels like this person is trying to understand me, as opposed to just telling me what to do with my life. And now I kind of feel judged. Right? So if you don't know what to say in a situation and it's really emotionally charged, remind yourself to get curious, ask those questions.
Mhm.
All right, so we're continuing with Adam, right? So as days go by, Adam starts to notice changes in their mood and their energy. They're irritable with participants. They're struggling to focus on safety measures and find it hard to appreciate the beauty around them. Right. One day, after a particularly difficult hike, a participant expresses concerns about Adam's demeanor. Hey, are you okay? You seem a bit off today. Right. So many of us have been in this situation where maybe somebody is bringing this to our attention. So Adam forces a smile, but feels a knot in their stomach. They brush it off, but that night, lying in bed, the weight of it all becomes overwhelming. I can't keep up with this. I love my job, but I feel like I'm drowning. I haven't had a day off in weeks. Right? Many of us can really resonate with this. And so I think another thing that we often talk to teams about and staff about is this dissonance, right? So when other people are picking up on the fact that something is off, right? Sometimes one of the most challenging things is, how do I answer authentically? And we always talk about group dynamics and the importance of having that predictability, right? So sometimes we talk about it in using the language of safety. Other times we're talking about it as just showing up in a consistent way. But sometimes it's really challenging to be able to answer honestly, especially if you don't feel like you have those resources. So in this scenario, we know that it's been several days that Adam's been working through this. And I think one thing we often assume with just mental health on program, especially for our staff, is that the stress happens only on program, right? Many of us are dealing with many different stressors, especially in this day and age, right? So it's very rare that many of us are coming into program completely in the green, right? But this is something that we really like to use. We call it, when we're doing mental health training, especially for staff, we talk about it using the stoplight model. Some of you also may have seen Laura McCladry's presentation on stress continuum, where again, she also talks about it from green, yellow, red, right? I think what's really helpful about using colors is that, again, when people are in a really emotionally reactive place, that area that processes our thoughts, that processes language and our ability to articulate what we're feeling really starts to power down, right? That's why sometimes when we're in those situations where we really want to say how we feel and we just can't find the words, it's because our stress system has really reprioritized what we need to do. We need to attend to the stress that we're feeling in that moment. We don't necessarily need to find all of the wonderful words to talk about what emotion we're identifying and feeling. And so we often use this to stratify risk, right? So green is I'm good. So this can be a low risk situation, could be a bad day, right? Could be low impact. It may be that, student got stung by a bee. It was really scary for them. You had to provide emotional support, and it's been 2 hours and they're over it. It was a little stressful, but we got through it, and it's not going to have a significant impact on the staff or on the trip. Yellow would be, I'm not great, but I'm functioning. Many of us are probably in yellow these days, right? So oftentimes internally, when I talk with my team about this, we often use this color system. And so, there's many different ways that you can use it. Sometimes we joke around and we say we're all a field of corn, right? Because we're all in the yellow, or we're a pumpkin patch because we're between yellow and red because it's been a really stressful week. But it's a way of being able to connect and communicate with each other without necessarily having to go to a really deep, vulnerable place. I think organizationally, one of the challenges that I often hear is, how much do I provide human connection and just support for my people versus becoming their therapist, right? So sometimes using this color system is just a really quick way for people to identify, this is where I'm at. right? So yellow, right, can be medium risk and it can have a moderate impact on functioning. Sometimes when we're working within these kind of stress containers, it's really challenging for us to be able to use some of the other self-care activities that we have. So it may be impacting our functioning. It may be impacting our ability to choose nutritious foods or to hydrate regularly. And that can just start to have a larger impact on our ability to focus or our ability to sleep well. And red is I'm not okay. I may or may not be able to manage what's in front of me, right? So oftentimes, either in yellow or in red, this is really where HQ is getting involved. They're really trying to support their staff. And so sometimes there are situations that are going on program where literally your focus is just on the person in front of you. You are just trying to make sure that you are getting everybody through something safe. It is a red level issue. It doesn't mean that you're falling apart, but it may mean that you need to make some sense of the situation and the experience and have access to connection and support. So it can be high risk, these situations, and high impact. I think, again, one of the things that we really appreciate is that sometimes there are multiple greens, yellows, and reds happening throughout a program, right? If you're really unlucky, sometimes they can all happen in one day or in 1 week. And so we really have to have language and ability to be able to support our staff. And one of the best questions when I check in with somebody using the color system that I ask right after they share where they're at is, what can I do to support you? It's not necessarily, oh, you feel anxious. Have you tried deep breathing? It's really helping. You're getting curious immediately. I understand what you're telling me. What can I do to support? And it might be, I just need 5 minutes so I can kind of come back. But other times it just helps people to recognize that, yes, the demand is very great right now. It's challenging my ability and my resources, but now you're actually giving me an external resource by giving me that support.
Yes, that really brings us to this idea of collective care. And I think this got really popular during COVID because the reality is we were all under a ton of stress. And even someone who is great at self-care and taking care of themselves, it just wasn't enough in that scenario. We needed community care, we needed organizational care, we needed collective care. So really looking at how we take care of each other. I'm going to share a quick story about this from my guiding experience that helped me understand how important this truly is to have embedded in your program. When I was about 23 years old as a river guide, I was on a lunch break of a 2-day trip, day one of a 2-day trip, and a crisis unfolded in front of us in which someone had drowned, and myself and some other river guides were involved in rescuing this person, and eventually the family and the other rafts and bringing them back to the company. And it was a very, at that age, I'd never experienced anything like that. It was extremely stressful. I got back to the office. I was completely checked out. I was in shock. And the first thing the owner of my company said to me was, Teresa, you have to go finish your 2-day. And I had to walk back to the rafts and I had to take 2 families who'd watched the whole thing happen on a 2-day river trip. I can tell you it was not a very good trip. I was absolutely terrified. I think a way I never had been before in my life of like, if something goes wrong right now, it's like I was so scared, right? Get back to the office the next day, nothing happens. No one says anything. No one talks about it. I do think debriefs happened in the organization, but they didn't involve the guides who had to go back out and keep guiding. And it didn't come up again. And from that moment on, I wasn't even cognitively aware of it, but my stress every time I got in a raft was so much higher than it had ever been before. And that eventually led me to leaving, the field over time, right? So when I reflect on that now as an adult and someone who's deeply involved in mental health, I think back on like this collective care piece and what could have happened, and how that would have supported myself and other guides. And so part of this is preventative, right? So the positive company culture. The piece here is, how do we do this with intention, right? Organizational rituals are huge. That is a great way to bring people together. An example, I worked for a river company where we had every Thursday, the bus drivers did a fish fry. And so it got all the guides and all the bus drivers and all the owners kind of together to have fun in a healthy way once a week. Like that's a fabulous ritual to create a positive company culture. That predictable structures we've talked about kind of at every layer of this presentation, but the reality is I, in that scenario, had no idea who to ask for help. It wasn't the kind of environment where somebody did ask for help, and there was a lot of reactivity in management. So how to do that was very, very unclear. So making sure your team knows what to do in these scenarios. Providing resources when available. This is tricky. Everyone on this call is somewhere different in a different kind of organization, but knowing what's out there can be super helpful. You know, an example would be there are some companies that provide free mental health care for river guides. Organizations like Cornerstone, you know, we support companies in this way, but what resources do you have available for guides who've undergone, been involved in a critical incident? And then the diffuse and debrief. I mean, this is just so important. There's a lot of data out there about how this can really help minimize the impact of acute stress down the line. So making sure your staff feels cared for, you're talking through it, you're helping to make sense of the incident. And then I love that 3-3-3 rule of, you know, you check in 3 hours after the incident, 3 days, and like 3 months down the road to check in and see how they're doing. This also gives you a great sense on if they're going to need continued support from you, or if you're going to help connect them to someone else. But really, this piece is what helps keep our guide and staffs healthy and coming back every year.
Awesome. Thanks, Teresa.
Yeah.
So when we talk about collective care, I think another thing just to kind of end on is the fact that many of us are kind of coming from different perspectives of mental health. And I think it's really interesting that over the time that we worked with Cornerstone, I think what we realized is that many younger generations are feeling very comfortable with accessing mental health resources, but we don't necessarily see that across the board. And so this isn't necessarily to generalize, but it is also to just recognize that, you know, what I often hear is that, you know, millennials and Gen Z, they often need more mental health support, and people are very curious, but they're also very confused as to why that is. You know, when I guided, or when I worked in this industry, I didn't necessarily need this. So why is it that there's so much attention around this topic? And I think what's really important, especially in light of recent events, that we start to recognize not what separates us, but actually what connects us. And so when we think about, regardless of how much experience and how much time you've had in this industry, that we all have our different generational gifts that can actually help to foster our mental health. And so we know that some of us are in leadership positions or have been guides for a long time, and boomers are our steady logs, right? So they often are talking about, you know, personal resilience and responsibility. And it's also really interesting because they've grown up with a certain level of stigma, right? But there is also this importance of self-reliance. And we have kind of Gen X and millennials, and so they're the kindling and the sparks. They're often the connectors, right? So many of them, again, are kind of advancing through this industry, or maybe starting to own their own programs. And so we're starting to see this really interesting shift, right, as this industry has grown, of just the value of balancing independence and that self-resilience, but also recognizing that mental health does exist, and we really need to be able to support our staff within our organization. And Gen Z, as we know, however we feel about our Gen Z staff, right? Many people can have very strong opinions about it, or maybe see some of the gifts that they also bring. It's also important to recognize that they are really helping our industry to evolve, whether it's digitally, but also just as advocates for mental awareness. And they're often prioritizing self-care. Sometimes I think that can be an issue that's related to some contention and different perspectives. But I think what we can do is we can recognize that there's a lot of connection that we can afford each other. And lastly, what we really want to emphasize is that we're stronger together, right? So finding common ground within our generational perspectives, that actually helps us to foster interconnectedness. And so we have lots of gifts here. We have opportunities to learn resilience. We have opportunities to learn how to better connect, how to better advocate for mental health. And we can draw strength from those experiences. So there are gaps in perspective, but it's really important that we continue to encourage each other to express emotion, but also to learn tools where we can figure out how to support people when they are going through stressful experiences so that we can continue to dismantle stigma in the industry. And then by sharing these types of stories and these perspectives, what we're doing is we're continuing to foster those supportive environments, enhance connection, and empower our people. So last but not least, this is just a little bit of a snippet. I know that with America Outdoors, often what they're trying to do is they're trying to connect you all to resources. So we do want you to know that resources do exist. If you loved listening to us virtually, we will be at the WRMC in person, and you can meet some of our team there as well. But this is just a sample of what's in our resource library. So if you're kind of thinking of ways to integrate mental health and support within your programs, this is just they're small knowledge bites. So it's not, it's not an extensive document, and it's really user friendly, and it's just to help to educate people on what maybe they need a little bit more support on, or ways that maybe we can potentially support you. And so we will pause for questions, but we really want to thank you all for your time today. Thank you very much. Any questions or any thoughts?
Lots of thank yous. That's great. This truly was a great session. So thank you so much for doing this for us. Um, I want to reiterate on the fact that there are resources available. And Maureen, thank you for saying that. I know Cornerstone has resources available. America Outdoors is partnered with Cornerstone, and so we do want to make sure that even if you're a small operator, that you do have access to some of those resources through us if you're America Outdoors member. So reach out to Cornerstone or America Outdoors if there's anything we can do to support you. There will be a recording of the session that will come out via email tomorrow and be on our YouTube channel. And then you'll get some contact information in that email too. Oh, we do have a question in the chat. This is not for me. This is for you. What is the best strategy for helping some older leaders who might not be naturally good with helping others handle their mental health, but are often approached because of their high technical skill set and overall respect in the organization? It's a good question.
Mm-hmm.
That's a great question. Teresa, do you want to take this one or?
Yeah, I'm just trying to think. I mean, I even wonder about some like utilizing that empathetic problem solving approach, or like what are like the really simple strategies for the older generation. I guess that's what came to my mind first, is that piece of like just letting him give him like permission to listen, like when one of the younger staff is going to them to listen and maybe share their own experience or how they got through it. I don't know, Maureen, if you have anything more tangible.
Yeah, Dan, it's a great question. And I know it's something that's come up before. And usually what I do is, again, like using that curiosity piece, I think can be really helpful, right? So understanding like what's the motivation in terms of not necessarily engaging with that student in that way and supporting their mental health. What's their belief around that, I think can be helpful, just so you kind of are understanding where they're coming from. But I think when somebody has a lot of highly technical skill and has had a lot of experience in this industry, what I will often do is I'll often lean into that strength and talk not necessarily about, hey, you're great technically, but like from a social perspective, like you're real, or interpersonal perspective, you're really struggling with our participants. What I will do is I'll try to kind of figure out like, is this strength, right? So sometimes when people have a lot of experience in this industry, one of their strengths is resiliency. And I think once resiliency sometimes gets out of balance, what people can do is they can kind of go inward, right? And it almost kind of cuts them off because they're worried about that vulnerability. And so I think sometimes being able to point out that, hey, it sounds like this resiliency piece for you is a strength, but it also sounds like sometimes interpersonally you're actually overutilizing this strength. So how can we maybe bring this strength back into balance? What are some ways where you might be able, instead of just leaning on resiliency, being able to hear that other student's perspective? Because we both agree we need to get this student to resiliency, but sometimes we need to be able to take a step back. And so oftentimes what we use in our training is something called ART. So it's ask, respond, tell, right? So sometimes when we're leaning a little bit too hard on resiliency, yes, we might be listening, but we're waiting for our turn to talk. And then what we're doing is we're saying, well, here's what worked for me, right? Instead, sometimes just that basic of try to ask a question before you actually tell the person what you think they should do. I hope that helps.
And I'll just add to that the role modeling, like giving those older guides the experience of like headquarters, like responding in those like ways that you would want them to be responding in the field can be really helpful in growing those skills over time.
Awesome. Again, so much gratitude for what you've done today for us. We really appreciate you being here and putting this all together specifically for our association and our members. So thank you so much. Thank you for attending, everyone who is here and supporting. We greatly appreciate you, and we hope to see you all soon.
Thanks, everybody.
Thank you.
Thanks.
We're here if you need us.